The United States is fighting a war on heart disease. It claims one life every 34 seconds. While we've made some progress in this war, doctors are now seeing a disturbing trend.
We're seeing that there's really a leveling off now of that decline in the rate of heart disease. So we're concerned now that we're going back up again.
Doctors use risk factors to see who has the greatest chance of having a heart attack or dying of heart disease.
And those include family history, having diabetes, being a male, increasing age levels, having high blood pressure, cholesterol, having an elevated blood sugar level, even if you're not diabetic, being overweight, smoking, physical inactivity, or a diet that is high in saturated fat.
National health organizations have developed guidelines to help people achieve a heart-healthy life and reduce their chances of dying. The goal? To say aloha to heart disease.
And we like to start off with A, which is the very fundamental assess your risk.
Certain people clearly rank high.
First of all, anyone who's already had a heart attack or has other evidence of cardiovascular disease, such as having had a stroke, an abdominal aortic aneurysm, having peripheral arterial disease, that means blockages in the lower extremities. In addition, anyone who has diabetes, individuals with chronic kidney disease, or very poor kidney function.
But for others, determining risk requires a bit of detective work. So how do you know which category you fall into?
Well, it turns out it's pretty easy because we have something called the Framingham Risk Calculator, where you can actually just plug in your numbers, your cholesterol numbers, your blood pressure, your age, what your gender is, whether or not you smoke, and out pops a number. And this number gets converted into the percent likelihood that you will have a heart attack or die of heart disease in the next 10 years.
But there is one thing everyone should be doing, whether you're at high, intermediate, or low risk.
L is the second letter in ALOHA, and it stands for lifestyle. It is, without a doubt, something that is within the control of each one of us. And if we eat heart healthy, we get regular physical activity, we don't smoke, and we maintain a nice healthy weight. We also know that a diet rich in fruits and vegetables, high in fiber, low in saturated fat, goes a long way to prevent heart disease.
Such lifestyle changes can help you maintain a healthy weight.
It's not body fat in general that increases our risk for heart disease, but where we deposit the fat. And when fat is deposited in the midsection and the waist size is thickened, that is when we see the risk for heart disease going up. The O in ALOHA stands for other interventions. There are certain medications that we recommend to protect individuals, and we recommend these depending on their level of risk.
One objective is to lower your cholesterol.
So it's very important when we think about methods to lower cholesterol, we have to think about reducing it in the diet. But we also, in some situations, need to reduce the amount that our body makes. And this can only be done through drug therapy.
Another goal is to keep your blood pressure at optimal levels.
An optimal blood pressure level is less than 120/80 for everyone. However, we use different cut points to determine whether or not we're going to use drug therapy in addition to lifestyle to lower blood pressure levels.
And one of the most important goals is to control blood sugar.
As a matter of fact, as doctors, we treat individuals that have diabetes as aggressively as we do patients that already have heart disease, because we know that an individual with diabetes is just as likely to have a heart attack or die of heart disease in the future as somebody who's already had, say, bypass surgery, a stroke, or a heart attack themselves.
people at the highest risk levels may need to take an extra step.
If you're at high risk of a heart attack or stroke because you have established cardiovascular disease or many risk factors for heart disease, then it's very important that you get on life-saving medications such as statin, aspirin therapy, beta blocker therapy, ACE inhibitor therapy. And this should be discussed with your doctor whether or not you're a candidate or there is some contraindication to those therapies.
Then there are the things you should avoid.
One good example of that is hormone replacement therapy. The American Heart Association does not recommend that women use hormone therapy as a method to lower the risk of heart disease or stroke because the data clearly now show that this may actually increase the risk. While much research has shown that individuals that eat a diet that's rich in antioxidant vitamins enjoy a protective effect from heart disease, the opposite has been shown to be true for individuals that consume antioxidant vitamins in a supplement form. We don't yet have completed clinical trials to help make definitive decisions about using aspirin therapy in our lower risk patients. But the American Heart Association suggested that in women who are at low risk of heart disease, we're not recommending aspirin therapy.
It's important to remember that these recommendations are meant as a guide and that the best advice should come from your healthcare providers. But if you follow these guidelines, the hope is that we can all say aloha to heart disease.
You have the power to live a long and healthy life. And we have to remember that there's a lot of people around each one of us that do want to see us be here tomorrow.